Hello. So I just wanted to talk a little bit about biologic augmentation of rotator cuff tear repair surgery, right? So, what we know about the rotator cuff is it can wear out and tear, and this is the most common surgery we would perform in our practice. If you look at rotator cuff surgery, the number one complication is that the tendon doesn't heal to bone after you reattach it. And if you look at the studies, those re-tear rates can be relatively high. So we want to do everything we can to minimize the chance of that happening. We use arthroscopic procedures, we use extremely strong implants, our rehab protocols, everything we do is geared towards that and maximizing your outcomes as a patient. Now, we have looked at, and what we think about this as orthopedic surgeons and scientists is that this is a biologic problem. There's something innately, wrong with that tissue. That's why it doesn't want to reheal when we reattach it. So we need to not just fix it mechanically, but we need to change the biology. So we've looked at different things. Something that has been utilized a lot in the last 20 years is PRP, which is platelet-rich plasma. Platelet-rich plasma is when we draw out your blood, spin it down in a centrifuge, and then get a high concentration of platelets in the serum. Platelets have a lot of growth factors in them that stimulate a healing response, right? Now, there have been over 30 or 40 studies done on PRP with rotator cuff repairs, and there's been almost no evidence that it's changed healing, right? So for rotator cuff tears. Now, PRP can be used for tendonitis and partial tears and non-operative treatment in some patients with some success, right? So I think that PRP does have a lot of utilizations in our shoulder practice, but when it comes to augmenting a repair during surgery, there's limited data on that, and it has not shown to be successful. So I don't use PRP for rotator cuff repairs because I follow the evidence. The second thing that people have looked at is something called bone marrow aspirate. And it's when we go into your iliac crest here and we put a trocar in there and pull out a lot of cells from inside your hip. And it's got a lot of healing growth factors. And think of it almost as supercharged PRP. There have been a few studies that have shown that maybe that helps some, but the results have been, it's been really, really limited. And there have been several studies that have shown it hasn't helped too. So that data is fairly limited. It's not harmful. Maybe it helps more than PRP, but really still the jury's out. And the problem is you have to go into your hip to take that out. It is a fairly expensive, time-consuming process. The last thing, which is what I actually prefer most in my practice and what we utilize the most, is something called amniotic membrane, or it's placental tissue. So it's allograft. So when a woman has a baby, we can actually take that placental tissue, sterilize it, irradiate it, take away any cellular material, so it's completely sterilized. But inside that is like magical growth healing materials, right? And one example I give patients talking about, how amazing that the placenta is there are babies actually that have spina bifida. So they have their spinal cords exposed. And we know this in utero now because we can see it with ultrasound. And what they'll do in these situations, and sometimes, is take the baby out of the mother at a certain time period. I'm not sure exactly, but probably around like 30 weeks, 28 weeks, I think. Do an operation where they close it and then put the baby back in the mother. And when they bring the baby out after a couple weeks of going back in, there is no scar. It's as if nothing ever happened because the biology and the healing environment inside a mother's womb is just, it's magical how quickly things heal and regenerate. So that tissue does have a ton of healing capacity to it, and we don't have to go in and dig into your hip and all these things. So we use that in a lot of patients. Some physicians will call that stem cells. It's a little bit, I wouldn't say a little bit, it's really a misnomer because technically you can't use real stem cells in the United States legally. You can't manipulate cells and put them back into someone. So if any doctor in the United States is telling you they're doing that, either they're doing something illegal or they're doing something, or they're not telling you kind of the truth about what they're doing. So PRP, BMAC, amniotic tissue, none of those things are really stem cells, but they can augment tissue in certain ways. But if you're looking at rotator cuffs, my preference is to use amniotic tissue. We can figure out the cost of that, and some of it has to do with insurance and different things, whether or not, it's covered, but it does work really well. And what it's trying to do is two things. One, it's trying to speed up the healing process. Two, it's trying to have you create what's called type 1 collagen versus type 3. Type 3 is disorganized collagen. It's the collagen that we really don't want. Type 1 is the nice, smooth, linear collagen that makes things strong and allow joints to move and glide smoothly. So we're actually trying to minimize scarring, minimize postoperative pain, speed up healing, speed recovery. And it does work really well. And it's been shown in multiple other areas of the body, with plastic surgery, with tonsil surgery, different types of operations where this amniotic tissue can be really powerful to get us the healing response we want. So that's my preference of all three of those, but we're happy to have a conversation with you about any of them. Thanks.